Welcome to the channel. When you swallow a pill, take a sip of syrup, or get an injection, have you ever wondered how that medication actually works inside your body? It's not magic, but a fascinating, complex journey that begins the moment the medicine enters your system. Every tablet, capsule, or liquid drug you take must first pass through multiple biological barriers before it can perform its healing task. The process by which your body takes in a drug and allows it to act is known as absorption, and it's one of the most crucial steps in determining how effective any medication will be. The story of absorption is a story of chemistry, biology, and precision, how molecules interact with cells, fluids, and organs to create balance and restore health. When a medicine enters your body, it needs to find its way into the bloodstream because that's the transport highway that carries it to the tissues and organs where it's needed. However, not all medications follow the same route. Some are swallowed and must survive the harsh acidic environment of your stomach, while others are injected directly into your veins, bypassing digestion altogether. Still others are inhaled through the lungs or absorbed through the skin in the form of patches or creams. The path the medication takes determines how quickly and efficiently it reaches its target. This process begins with the formulation, the way the drug is designed and delivered. Tablets are made to dissolve slowly or rapidly, capsules may protect delicate ingredients, and liquids are often absorbed more swiftly. When you take an oral medication, the first thing it encounters is the stomach. Here, powerful gastric juices begin breaking down the pill's outer layer, releasing its active ingredients. But not all drugs can survive this acidic environment. Some are destroyed by stomach acid, which is why they're coated with a special layer that protects them until they reach the intestines. The small intestine is where most absorption takes place because it has an enormous surface area lined with millions of tiny finger-like structures called villi. These villi increase the contact area between the drug and the intestinal wall, making it easier for the medication's molecules to pass into the bloodstream. Absorption is influenced by several factors: the chemical nature of the drug, whether it's water-soluble or fat-soluble, the pH of your digestive system, and even whether you've eaten recently. For instance, a fatty meal can slow down the absorption of certain drugs, while others require food to be absorbed properly. Temperature, blood flow, and individual body chemistry also play a part. The lining of the intestine acts as a selective barrier, allowing only certain molecules to pass through. Fat-soluble drugs can easily slip through the lipid-rich cell membranes, while water-soluble drugs might need the help of transport proteins or specific channels to cross. Once a drug crosses into the bloodstream, the absorption phase is technically complete, but the real work has just begun. The bloodstream distributes the medication throughout the body, delivering it to the sites where it can act. However, not all of the drug reaches its target. Some is lost along the way due to binding with plasma proteins, metabolism by the liver, or excretion by the kidneys. This is why dosage matters too little, and the medicine may not reach effective levels. Too much, and it could cause toxicity. There's another fascinating step in the process called the first-pass effect. This occurs mainly with oral drugs. After being absorbed in the intestines, the drug travels through the portal vein to the liver, where enzymes may break down a significant portion of it before it even enters the systemic circulation. This means only a fraction of the original dose reaches the bloodstream intact. To compensate, pharmaceutical scientists design drugs with specific coatings, formulations, or dosage strengths to ensure the right amount makes it past the liver. When medications are injected into a vein, intravenous route, absorption is bypassed entirely. The drug enters directly into the circulation and begins working almost immediately. That's why medications are used in emergencies. They act faster because they don't need to go through the digestive process. Intramuscular injections, on the other hand, allow the medicine to be absorbed gradually as it diffuses from the muscle tissue into the surrounding blood vessels. Subcutaneous injections, like insulin, work similarly but slower, providing a steady release over time. Inhaled medications, such as those used for asthma, are designed to target the lungs. The air sacs in the lungs, called alveoli, are surrounded by a rich network of blood vessels. When you inhale a drug, its particles travel deep into the lungs and diffuse across these thin membranes directly into the bloodstream. This is a fast and efficient route for certain medications, especially those meant for quick relief like bronchodilators. Similarly, transdermal patches deliver drugs through the skin into the bloodstream, bypassing the digestive system altogether. This method is often used for drugs that need to maintain steady levels in the blood, like nicotine patches or hormone replacement therapy. Sublingual and buccal routes under the tongue and inside the cheek are other clever ways to deliver drugs quickly into the bloodstream. The mucous membranes in these areas are thin and rich in blood vessels, allowing rapid absorption. Nitroglycerin tablets for chest pain are a classic example of sublingual administration, where the drug works within minutes because it avoids the first-pass metabolism by the liver. Rectal and vaginal routes are used in cases where swallowing is not possible or when local effects are desired. Absorption is not a one-size-fits-all process. Every person's body handles drugs slightly differently due to genetic variations, age, weight, gender, health status, and even gut bacteria. For example, an elderly person may have slower gastric emptying and reduced blood flow, which can delay drug absorption. On the other hand, children often have faster metabolic rates that can influence how quickly a drug is absorbed and processed. Even the time of day you take your medicine can make a difference, as your body's biological rhythms affect hormone levels, stomach acid production, and blood flow. Once the medication enters your bloodstream, the next step is distribution. Think of the bloodstream as a network of highways that carries the active ingredients to every organ and tissue in the body. But absorption and distribution are closely connected because how well the medication was absorbed determines how much of it actually gets distributed. Some drugs prefer certain tissues over others. Fat-soluble drugs may accumulate in fatty tissues, while water-soluble drugs circulate more freely in the plasma. This selective distribution helps explain why some medicines have longer effects than others. When a drug lingers in fat stores, it's slowly released back into circulation over time, maintaining its presence in the body even after you stop taking it. Blood flow plays a major role in this process. Tissues and organs with high blood flow, such as the liver, kidneys, heart, and brain, receive medication faster than areas with poor circulation like bones or fatty tissues. That's why painkillers can relieve a headache quickly. The brain receives a rich blood supply that allows the drug to reach its target swiftly. But this also means that diseases affecting blood circulation can slow down how well medications are absorbed and distributed, making them less effective. For example, people with poor circulation due to diabetes or vascular disorders may experience delayed or incomplete absorption. The structure of cell membranes also influences absorption. These membranes are made of lipid bilayers that act as barriers to water-based molecules, but allow fat-soluble molecules to pass through more easily. Some drugs are designed to mimic natural molecules in the body to trick these membranes into letting them through. Others rely on specialized protein carriers transporters that actively move them across the membrane. This intricate system of selective permeability ensures that only the right kinds of substances enter the bloodstream, protecting the body from harmful chemicals while allowing therapeutic agents to pass. Another important concept is bioavailability, the percentage of a drug that actually reaches systemic circulation in an active form. Intravenous drugs have 100% bioavailability because they go directly into the bloodstream. Oral medications usually have lower bioavailability because they're partially broken down in the stomach and liver before reaching circulation. For example, if you swallow 100 milligrams of a drug and only 50 milligrams makes it to your bloodstream, its bioavailability is 50%. Scientists calculate this when designing doses, so that patients receive the right amount to achieve the intended effect despite the losses during absorption. The rate at which a medication dissolves, called dissolution, also determines how quickly it's absorbed. Drugs in liquid form dissolve immediately, leading to faster absorption. Tablets and capsules must first break down before the active ingredient can be released. Some tablets are formulated as controlled release or extended release, meaning they dissolve slowly over several hours to maintain steady drug levels in the body. This helps avoid the peaks and crashes that can occur with fast-acting medications. The stomach's pH also influences absorption. Acidic drugs like aspirin are absorbed better in the acidic environment of the stomach, while basic drugs like morphine absorb more effectively in the alkaline environment of the small intestine. That's why some medicines are prescribed to be taken before meals and others after. Taking the wrong medication at the wrong time can affect how much of it your body actually uses. Similarly, antacids and proton pump inhibitors, which reduce stomach acid, can interfere with the absorption of certain drugs by changing the pH level in the digestive system. Your gut microbiome, the collection of trillions of bacteria in your intestines, plays an unexpected but powerful role in how medication is absorbed. Some gut bacteria can break down drugs before they're absorbed, altering their effectiveness. For example, antibiotics can disrupt gut flora, which in turn may change how other medications are processed. Scientists are only beginning to understand the complex relationship between gut bacteria and drug metabolism, but it's becoming clear that your microbiome can make the same medication work differently from person to person. After absorption, metabolism takes over. The liver acts as the body's main chemical factory, modifying drugs to make them easier to excrete. Sometimes these transformations activate a drug, while other times they deactivate it. Medications like codeine, for example, are converted by liver enzymes into morphine, which provides the actual pain relief. In contrast, other drugs may become inactive or even toxic if metabolized improperly. Genetic variations in liver enzymes explain why two people can take the same dose of a drug but experience different effects. One may find relief, while the other feels nothing or develops side effects. The body's absorption efficiency also changes with age. In infants, the digestive system is still developing, and stomach acid levels are lower, which can delay the absorption of certain medications. In older adults, slower gastric emptying and reduced enzyme activity can alter how drugs are absorbed and metabolized. Dehydration, which is more common among the elderly, can reduce blood volume and slow circulation, further influencing absorption. That's why dosages are often adjusted for children and seniors. Their bodies simply process medication differently. Diseases of the gastrointestinal tract can dramatically alter drug absorption. Conditions such as Crohn's disease, ulcerative colitis, or celiac disease can damage the intestinal lining, reducing the surface area available for absorption. Diarrhea can push drugs through the system too quickly, preventing full absorption, while constipation can prolong contact time, potentially increasing absorption beyond intended levels. Similarly, liver and kidney diseases affect how well drugs are metabolized and eliminated, which can cause them to build up in the system and lead to toxicity. Another factor that can alter absorption is drug interaction. Some medications compete for the same transport channels or enzymes, reducing each other's effectiveness. For instance, taking iron supplements with certain antibiotics can form insoluble complexes that the body cannot absorb. Grapefruit juice is another famous example. It inhibits specific enzymes in the intestine, leading to higher levels of some drugs in the bloodstream and increasing the risk of side effects. Because of such interactions, doctors often advise taking medicines at different times or avoiding certain foods altogether. Even posture and activity level can affect absorption. Lying down immediately after taking medication can slow gastric emptying, while light physical activity can increase blood flow and enhance absorption. Studies show that taking certain medications with a full glass of water helps them dissolve more effectively and reach the intestines faster. Hydration also plays a critical role in maintaining good circulation and supporting the body's transport systems. Body temperature can influence how well some topical and injectable drugs are absorbed. Warmth causes blood vessels to dilate, increasing blood flow and speeding up absorption. That's why heating pads are sometimes used with transdermal patches to enhance drug uptake. Conversely, cold temperatures constrict blood vessels and slow the process down. Understanding how these physical factors interact with medications can help patients use them more effectively and safely. The design of modern drugs often incorporates sophisticated delivery technologies to optimize absorption. Nanotechnology, for example, allows medicines to be packaged into microscopic particles that can pass easily through biological barriers. Liposomal formulations encase drugs in fat-based shells that protect them from degradation and improve absorption of otherwise poorly soluble compounds. Smart drug delivery systems can even respond to specific triggers like pH changes or temperature shifts, releasing their contents only when they reach the target area. Once medication molecules are circulating in your bloodstream, they begin encountering a variety of biological filters that decide how much of each substance reaches the site where it's needed. The capillaries that line your blood vessels have tiny pores allowing smaller drug molecules to pass through easily, but larger or protein-bound compounds move more slowly. Some tissues, like the brain, have an additional layer of protection called the blood-brain barrier, which prevents many chemicals from entering. Only certain fat-soluble or specially designed drugs can cross this barrier, which is why not every medication you take will affect your brain. The same principle applies to the placenta during pregnancy. It allows some medications to pass through to the fetus while blocking others, which is why doctors carefully evaluate the safety of every drug prescribed to pregnant women. Once a drug reaches its target, it must interact with receptors, specialized protein molecules on or inside cells that respond to chemical signals. The success of absorption is ultimately measured by how much of the medication can reach these receptors in its active form. If the drug binds too tightly to plasma proteins in the blood, fewer free molecules remain to interact with the receptors, reducing effectiveness. On the other hand, drugs that are highly free in the bloodstream can act more quickly but may also wear off sooner or cause stronger side effects. Finding the balance between free and bound forms is part of what pharmacologists calculate when designing dosage levels. Your body constantly works to maintain equilibrium, so while the medication is being distributed, it is simultaneously being metabolized and eliminated. The liver transforms fat-soluble substances into more water-soluble ones so they can be excreted by the kidneys. But metabolism can also create intermediate products that have therapeutic or toxic effects of their own. This entire interplay means that absorption is not simply about getting the drug into the bloodstream. It's about ensuring it's there long enough in the right form and at the right concentration to achieve its purpose. For transdermal medications, those delivered through the skin, absorption depends on the thickness of the skin and the condition of the surface. Areas with thinner skin, like behind the ear or on the inner arm, allow quicker absorption than thicker regions such as the palms or soles. Oily or moist skin can enhance penetration, while dry or damaged skin may alter how much of the drug passes